Here's why x-rays might not be taken on our new patients. Now, isn't it dangerous to not have x-rays? Well, not according to research and healthcare professionals. We have patients ask us all the time, don't you need to take x-rays on me? My other chiropractors always did. And hey folks, I'm Dr. Jeff Williams, and this is kind of a big one, all right? I get this question fairly often from my new patients because, well, I think the way we do things here at Creekstone, well, sometimes it might surprise them. Having been in the chiropractic field for well over 20 years, I absolutely understand this question. We were taught in school to take x-rays on everyone that comes in the doors. And it was important so that we can make sure that we don't inadvertently cause any damage to our patients because we're working on something that maybe it had more issues than we were expecting it to have. But things like maybe cancer or fractures or something of that nature, right? Well, before we get in deeper here on this information, I want you to share this with your friends and family so that they are as smart as you are, okay? Or as smart as you're about to be. Now, doing that really helps us continue to grow our message and our clinic. We watch social media, we pay attention, and I hope you know how much we appreciate each of you that really helps us. Now, the great news here is that since I graduated from chiropractic school, more and more research has come out. New research turns into updated guidelines and recommendations, right? As we learn more, we change how we do things. At least we should. We're supposed to. That's what research is for in the first place, isn't it? To update our knowledge base and potentially change and improve the way we do things. Well, that's definitely the case here for how we do x-rays and MRIs or CT scans and when we recommend them. First, there is solid research showing us that when we take unnecessary x-rays or get unnecessary MRIs, the findings many times are meaningless. And trust me folks, hey, we can find something on any and every x-ray or MRI ever taken. It's easy to find stuff because it's normal, usually. These findings are typically meaningless. However, highlighting them and focusing on these findings can, in the eyes of the patients, be scary and concerning. And patients tend to catastrophize these meaningless findings. They start to think that maybe they're somehow broken or fragile or weak or not normal, right? Not only that, they may also start to back away from activity because, well, they're afraid of doing more damage. More damage to something that wasn't a problem to start with and probably should have never been mentioned in the first place. Now, when people start to avoid activities because they're trying to prevent more harm or damage, even though that is perceived and not real, well, they become more sedentary. And when you become more sedentary, your muscles and abilities start to decondition very quickly after only 7 days. And becoming sedentary leads to more and deeper chronic pain, depression, anxiety, and sleep issues. And that's just to name a few of the issues. There's lots more. Now, understanding all of this, then we know that it can be just as dangerous to take x-rays and then the provider either purposefully or unintentionally convince a patient that they're broken. Well, that's just as bad as it would be to not take x-rays in the first place. Many times, anyways. Now, fortunately, a lot of research has been done on this very issue in more recent years, and new guidelines have emerged which help us providers determine when x-rays are appropriate and when they're not appropriate. So to be clear, some providers simply were taught every single patient should have an x-ray regardless. Some just feel better knowing the specifics of every single thing going on with the bones in a person before they start putting their hands on them. I get that. And certainly don't condemn these providers, neither should you. We have to run our clinics in the best way that we see fit, the most responsible way, and that should be respected, especially when we're talking about x-rays and the need for them. But with that being said, let's talk about who needs x-rays and imaging and who probably doesn't. Well, these recommendations are called Choosing Wisely and are endorsed by the American Chiropractic Association. It's a nationwide association for chiropractors. So when red flags are present, x-rays are indicated. So red flags for getting x-rays. Let's go through some of these. One of them is the patient is less than 20 years old or older than 50. okay, then they should probably have x-rays. If the patient was if the pain was caused by traumatic onset, something like a fall or an accident or a car wreck, they definitely need x-rays, and believe me, they get them here. If the patient has a history of cancer, they probably need x-rays. If the patient is having pain at nighttime, probably need x-rays. If the patient is running a fever, you need to make sure. Let's get x-rays. If the patient is experiencing unexplained weight loss, again, x-rays. If the patient has pain at rest and just cannot find a comfortable position, we need to get some x-rays. If the patient has immune suppression, such as corticosteroid use. If the patient has had a recent infection. If the patient has a generalized systemic disease like diabetes. If the patient had failure of 4 weeks of conservative care, which also means if you've been doing physical therapy or chiropractic or anything else conservative for 4 weeks with no relief or improvement in your condition, and you don't have recommendations for x-rays or MRIs to clear it up and see what's going on, you as a patient should be either requesting those x-rays yourself, or you need to be finding a different provider. It's common to hear my new patients tell me that they've been going to a different provider for 3 or 4 months with no improvement. They just kept on doing the same thing over and over and over, thinking magically after 3 or 4 months they were going to get better. And they didn't. So they went somewhere else, right? This should not be happening. If the patient has cauda-equina syndrome, that is damage to the central nervous system, to the spinal cord, that can typically cause saddle anesthesia or numbness and tingling in anything that would sit on a saddle and touch a saddle. The sensitive stuff, right? And or bowel or bladder dysfunction, the inability to control bowel or bladder function. This cauda-equina syndrome is an emergency. You need to go to the ER. Now, also, if the patient has motor weakness in the lower limbs, meaning they can't get on their tiptoes and take a few steps, or cannot get on their heels and take a few steps, I also have them try a little half squat or quarter squat. And if patients can't perform these simple functions, well, they need imaging as well. And this last red flag is a biggie. Do not use repeated x-rays. This is more for a provider, okay? Do not use repeated x-rays in an attempt to prove treatment effectiveness. A lot of folks, they take repeated x-rays over and over and over, try to prove that what they're doing is effective. And this puts the patient at risk of increased exposure to radiation that is simply unnecessary. So, there you have it. When these red flags are not present in our patients, well, then we do not do x-rays on them. In fact, we don't even have an x-ray machine here in our clinic, and our patients tend to be very appreciative of the fact that they don't have to go get x-rays just because they slept weird and woke up with a sore neck. This is why we are typically able to do an exam and treat our new patients all on the same day on the first appointment. This also tends to make our patients' very first appointments fast and efficient. Patients really love that part. Nobody's got time to sit in an office all day or to come back and do all that stuff. Most of our new patient appointments can typically happen within 48 hours of the first call, unless of course we're up against the weekend. But they do tend to fill up fast, so we recommend calling just as soon as you got an issue. And we'd love to help you get out of pain and back into your life. If we can help you, just call us at 806-355-3000. We'll get you on the schedule as soon as possible. If you're watching on social media, share, subscribe, like, comment, so that we can continue to grow our message and grow our clinic and help our city and our population. We watch and we appreciate each of you more than you know. Thanks for watching. We'll see you right here next week with more useful teaching.